Hey there, welcome to Eating Enlightenment. Today we're talking about CBD. CBD can be used to calm anxiety and reduce inflammation, and there's basically no negative side effects. I'm talking with Dr. Thomas Rocco from Back to Basics CBD, and kind of a fascinating story, fascinating benefits about CBD. And I love Thomas's passion for this. I love it. I absolutely love it. And the reason I'm bringing this conversation on is because a big part of eating enlightenment is changing the way we think about food and substances. Like, I'm a big advocate of psychedelic mushrooms in the right setting, the right place. And people think horrible things about psychedelic mushrooms, and they've really made a big impact in my life. I think we also think bad things about CBD. But I said earlier, there's no negative side effects to CBD. You don't get high from CBD. Okay? So I want to challenge your notions of CBD. And I'm bringing on a doctor who is one of the world's leading health experts on bringing the best information about CBD to the public. That's his mission, to help educate the public about dosages, about different types, about the benefits, about how to use it, the costs, et cetera, et cetera, et cetera, get more research on it. So without further ado, let's welcome on Dr. Thomas Rocco from Back to Basics.
So we're talking about CBD today, and Dr. Tom has his own unique introduction to CBD and where that came from. So just give us like a quick summary and how you got into this field.
Right. It's really, I fell backwards into it. It started with being with the Department of Health, educating people with medical marijuana. And that was about 8 or 9, 10 years ago. There's a practice that's licensed by the Department of Health. It's the only one of a kind. It's not even done in other states. So everything we do is licensed, regulated, overseen by the Department of Health. So when somebody's appropriate for medical marijuana, they're appropriate. They have to go through the proper steps. So we did that. And then we've been doing this practice has been around for about 8, 10 years. But in the last 2 to 3 years, CBD is now like in the forefront. And we figured, let's do a website. Let's do some education. You can't find it online. There's no doctors doing this. So we started a website about 2 years ago called backtobasicsllc.com. And the main goal of it is not just buying really good products, but it's learning like how to use it, what's the right dose. Any good studies that I can find is on our CBD Health tab. We do some videos, we do some blogging, but mainly it's about learning like what to do so you're not misled. And so we've been doing about 1.5 years, and it's been great. We've had some great positive results from it. Doesn't help everybody, but it is a good therapy. The side effects are limited. It's really going very well.
Yeah, so we'll start like super high level. CBD, what does it stand for?
It stands for cannabidiol.
So it's like a extract sort of from cannabis.
That's right. So when you think of CBD stands for cannabidiol. So CBD and THC are both cannabinoids. Those are the cannabinoids are what you find in the hemp plant, the marijuana plant, that causes their effect. So when you think of THC and CBD, they're actually cousins. That's the problem with it, because people think I'm going to get high from CBD because it's the cousin of marijuana, but it doesn't happen that way.
How does it happen? How is it different?
Right. So the real reason why it's different is because THC binds to receptors. So THC, CBD, any other cannabinoids, as CBGs, CBNs, they all affect the endocannabinoid system. And there's 2 receptors, CB1, CB2. CB1 is mainly in the brain and in our spinal tissue. CB2 is mainly in our immune system, in our peripheral nervous system. So THC mainly works at CB1 levels, but it does it in a way where it interacts and binds to it. So now that receptor isn't working properly, and we get that high effect. It doesn't, that effect is it's binding to the receptor. Now it doesn't work properly in our brain and we're getting a high. Same thing like with narcotics. When you take a narcotic for pain, the pain's not going away. My perception's different. It binds to the receptor that it's going to act at. Why CBD is safer is it doesn't bind to CB1 or CB2 receptors. It boosts their effects so they're acting normally. So that's why you don't get a high from it. It's just helping the neural tissue work better against inflammation. It helps our immune system work better, and it makes you feel better. So you'll never get a high from CBD alone because you're just boosting the receptor to work better. It's kind of the analogy of, say I got a car and I put rocket fuel in it. It's going to make it go faster. But the thing about CBD is you can't overdose on it, because if I put tons of rocket fuel in it, it's not going to, the car's only going to go so fast. So it's only going to boost your immune system as much as it can. So it's almost like taking, say, multivitamins. When you take vitamin C tablets, the body's going to take what it needs. And what does it do with the rest of it? It gets rid of it. The same thing with CBD. So that's why we like to start at the lowest dose. There's no reason to take a lot of it. The lowest dose might do that enough boosting of your immune system for it to work.
Absolutely. And this calms the body when you can have these receptors be more open. It can kind of calm the body. You're not getting high. The reason, if you're listening, I wanted to bring on Dr. Tom. We're talking about CBD, even though normally we're talking about food, body, and soul and stuff like that, is because anxiety is such a big thing for so many different people. And Dr. Tom's, one of his missions is to really make sure that people understand CBD from a really qualified and understand kind of the quality behind it, I'll say, and how it can help. I'm interested in it from an anxiety standpoint, but I also know it can be useful for inflammation, for joint pain. What else can it be used? I guess, are those the two biggest things, anxiety and joint pain, or maybe just general relaxation?
Right. The main reasons we talk to patients about is pain, any type of pain, joint pain, muscle pain. The other reason is anxiety. It helps with sleep. It helps with general wellness. At very high doses, it helps with seizure prophylaxis. Those are really high doses. So when we talk about just saying for anxiety, we tell patients a low dose, 15, 20 milligrams, and you can use that multiple times in a day, and people get worried, like, am I taking a lot of this? But you're not, because people that need it for seizure prophylaxis to really saturate the brain, you need about 1,000 milligrams a day to 1,500 milligrams. So we're at the low end of the curve. You start it low, and that's usually how it works. You don't have to go to a high dose. But the reasons behind all of it, the same thing like how it helps migraines, how it helps anxiety, how it helps pain, is we have this stress, this inflammation in our body, and it's boosting our immune system to deal with that stress better and get rid of that inflammation. On our website, there's a research about how it helps migraines. And essentially what it's looking at is the mechanism, how it's decreasing the inflammation causing that pain. It's really very interesting. People have different concepts of why it's working, but that's what it comes down to. It's getting rid of the inflammation, getting rid of the stress of your life by boosting your immune system and making you feel better.
And what got you to switch from, like, you were in medical marijuana at this one of a kind health center?
I'm still doing that.
Yeah. So like, what got you into CBD? Like was the CBD basically with CBD, as I understand it, if it's quality sourced and you're doing it the right way, there's like no downfalls of it. Like marijuana, memory loss, there's like, there's downfalls, there's negatives to it. With CBD, I mean, I'm not hearing any negatives, which is kind of cool. Is that what got you into it, or like, was it just something new and you needed a change in life? Or
the first thing was it was new, and I wanted to learn more about it, and this really got me to learn about it. And it took a good 6 to 8 months starting the website, researching it, understanding it, and now it's easy for me to talk about it. And the other reason why is because I didn't find any doctors that understood anything about CBD. So I thought maybe we could be the point of reference for patients anywhere in the country to call about, how do I do this correctly? So that's how we kind of started this, and we've kind of just gone with it for the last year and a half. It's been,
So
it's been great. We've had some great stories with it.
yeah, like what any stories that come to mind that kind of exemplify the like what happens when you start taking CBD in addition to some other stuff? Or
We had one woman here came with her daughter, and she was taking 6 Percocets a day. And the
oh my
daughter was
gosh.
concerned because she was taking 2 in the morning, 2 at night, 2 during the day. It was helping her pain, but she was very groggy all the time. She wasn't that active, and she needed something different. So she came in, we did a whole hour of free consultation, went over everything. So she starts now with 2 capsules in the morning, 2 capsules at night, and she uses a topical for anything else additional. In about 4 months' time, she was off all her Percocets. Unbelievable, right? So her daughter says, she's still in pain, but the things that are improved is she's not falling. She sleeps better. She's never groggy. And you know what? With the narcotic, she was getting intestinal upset, so she's eating much better. So her quality of life is phenomenal. So she gets medications every month. She's off all her Percocets, and it's a godsend. She's been doing that for over a year. She's one of our first really great story in 2019.
Hell yeah.
Just today, a person walked in today, called me up, I need my capsules, but my wife needs the oil. Can I come in? Sure. So what happens is they come in and you start talking about why they're doing it. She amazingly is off her methadone now that she's on CBD capsules and oils. So what she does is she has pain all the time. The first thing she does in the morning is she does an oil and a capsule, because the oil is going to work immediately and the capsule is going to work all day. She just gets it in her body, and then she takes another one later in the day, and once in a while she uses another oil. And using this in the last 3 months, she's off all her pain pills. She takes a little bit of naproxen, and she uses CBD, and it works great because CBD is metabolized by the liver, naproxen's metabolized by the kidney, so it doesn't interact. And now she's off of methadone and all her narcotics. I mean, that was just, the guy came in today, and we've been dealing with him and helping his wife for over this whole summer through COVID. So that's another phenomenal story.
Yeah. I wasn't even thinking about it being you hear all these the opioid crisis, right? Like I wasn't even thinking that CBD could be sort of a natural replacement for all these opioids, painkillers, the things that are that's huge.
It's huge.
That's potentially yeah. Yeah, have you heard of Nate Diaz in the UFC? Nate Diaz?
No, I have not.
He's a fighter, and he's starting to promote CBD for, because fighters, they beat the crap out of themselves and the joint pain and stuff. But I just was hearing about it and just seeing this market, this incredible opportunity to, instead of having all these fighters be taking all these medications, and he was saying, hey, this works, it's better.
Right.
I feel this tremendous potential. Yeah.
I've written under the CBD health tab about how it could help with exercise fatigue. And I found an article that talked a little bit about it and they expanded on it, but it makes sense how it gets, when you're working out, you're breaking down muscle cells, and how to get rid of that muscle, get the muscle recovery return quicker, the fatigue, improved. It makes sense to take CBD because it's going to get rid of that inflammation. It definitely has a role. It really does. I think it has a role for that. The problem with CBD is the roadblock is the cost.
Oh,
that's the problem. It can be very expensive. Insurance doesn't cover it. I do have a couple of patients that get it covered through their medical plan. Have written a note that they're using it medicinally, and they're paying into this plan through their work, and it does get covered. But outside of that, insurance isn't covering it.
Interesting. That's kind of a bummer. I guess it's not it's really not mainstream yet, I guess.
No, it's not.
Yeah.
The problem is there's just there's so many companies out there, and it gets very, very confusing. For regular medication, just like aspirin, it's very simple. People know it's 81 milligrams for the little one. It's 325 milligrams for the bigger one. and the instructions are there. But for CBD, different companies have different dosing, and it's very confusing. It's not regulated at all. And that's what we're trying to do. We're trying to standardize this. So when people get medication from us, not only do they get a sheet about that product, how much it takes to get this dose, we have a dosing guide about what you would take for different types of medical illnesses. And again, anxiety, sleep, general wellness, and pain. And so you know where to start. This is the initial dose, and you can work yourself up from that.
Interesting.
And so what we do is we talk to patients, and then we have a list of who's we've talked to. And then usually 2 or 3 weeks later, I'll call them again and say, how's it going? Do we need to manipulate it? Are we good where we are? And then you work from there. Most people it helps. There are some people it doesn't do anything. But then there's a lot of people that don't do it because it costs money.
I see. Yeah. And I know you mentioned oils, you mentioned capsules. I know Nate Diaz in the UFC, I believe he had rolled a joint, right? So this is his way of marketing it. He was like smoking a doobie, but you're not, I don't think they drug test and whatnot. Right. But he was like, no, it's CBD, it's not weed. So he was all, so you can smoke it, right? I guess. So there's all these different...
if you want. They do have that. We don't sell that. But you can buy a roll of CBD. Absolutely.
I could see why it would get confusing. Like, like what's the dosage and these 3 different modalities, and if there's different companies doing different, levels and so forth. Like so if someone has anxiety, like, or joint pain, let's go through both, right? Someone has joint pain, someone has anxiety. Where do you start? Drops, caps? Like how much?
Depends on the type of symptoms. Like anxiety, I love oils because it's going to work quickly. 5-10 minutes. Like for migraines, anxiety, you want an oil. It's going to work immediately because you get it under the tongue, let it sit there, it gets absorbed into the body, and then you get the effect in 5 to 10 minutes. And then you can redose it if you have to in 15 minutes. Capsules are more for a person that's always in pain, and they take it just to kind of get it in their body, and then they use the oils on top of that if they need something additionally. So patients
are like quicker.
Right, much quicker. But my older patients, that generation, they love capsules. That's what they were brought up with. And that's what they tend to use, but they understand that it's not going to work immediately. It takes a half an hour for it to work.
So I assume it also kind of like it goes away slower. It kind of stays with you longer. Okay.
Right. An oil is going to work in 5-10 minutes. It's going to last 2 to 4 hours. A capsule is going to work 6 to 8 hours. So it's going to last longer.
Interesting.
So if you take the same dose of an oil and a capsule, the peak effect of the oil obviously is higher because it's faster and you get the effect quicker. The capsule takes a little bit longer. So I tell patients use oils for something acute like anxiety, for pain. You need it quickly relieved. Stress. The capsules are mainly for people that are in pain all the time, or even somebody who's, I have one patient who's high strung all the time. He just likes to get a capsule in his body and then uses an extra oil when the stress is worse.
Interesting.
If things are minor and localized pain, I usually say use a topical because they're the cheapest.
Yeah.
If it's just elbow pain, knee pain, shoulder pain, use a topical first because those are the most inexpensive.
Oh, the creams.
Right.
I see. Okay. And what I love, so if you're listening to this and like it might sound like we're recommending to run away from pain, but I don't, or like it might sound like we're basically saying take this to avoid feeling pain. But I really want to come back to this, like CBD, when we're talking about pain and the real pain people are in, it doesn't, it's not like heroin. Heroin kind of, I've never done it, but or whatever, or like alcohol, it takes away the pain. Right. And it sort of takes away the cognition behind it. Like you're not present. You're not present. CBD, I don't know how to describe this, but you're there. You're not there. You're there.
Absolutely.
Like you're not. Absolutely. It's not distorted. I guess it relaxes you a little bit. A bit.
Yeah, it does. It helps your immune system make you feel better. It definitely relaxes you. We have one product. It's called Dream. It's really to help you sleep, but help you relax. It has the cannabinoids in it that help with those products. It has CBD in it, but CBNs are also another type of cannabinoid that's helpful for sleep and for relaxation. So there's different cannabinoids that help different things and different medical problems. And that's what we're still learning about. That's why I think this all fits into what you're trying to do. I think this is
it does.
This all kind of goes with what you're trying to do.
It's holistic. It's
mind and body.
It's not detracting from the present moment. It's not an escape. I'm trying to wrap my mind. It's like it helps people kind of maybe calm down a little bit and feel more without getting overwhelmed in some ways.
But it is fixing the problem, like that stress, that inflammation. Whereas when you take an anxiety medication, a narcotic, or even alcohol or THC, it's binding to the receptors. So like you said, your cognition doesn't realize it's actually there.
Yeah.
But when it wears off, it's still there.
Yeah.
Right?
Yeah. Like you check out. It's an escape.
Right. But this is helping the problem.
Yes.
That's what's nice about it.
Yes. I'm almost like, why not? What do you use for CBD? If it's not bad, do you just take it every day and it's basically good?
I use it as needed. That's the best way. That's
okay.
But I have some people that do it every single day and it helps them. I have one person I work with. He's active military. So he needs the CBD that has absolutely no THC in it. And so he knows from me it's coming from a reputable source. He uses it every morning. It just helps him in the morning because the anxiety of the day, getting up, doing his work, it just helps him during the day. But that's it's the first thing I ask patients when they're trying to use CBD is, are you worried about drug testing? Because there's three main types of CBD. There's full spectrum, which means that it's mainly CBD with a small amount of THC. Doesn't make you high, but if you do a drug test, it could come positive for THC. And then there's two others called broad spectrum and isolate, which have no THC in it at all. So those are important. If somebody says, I am worried about drug testing, I have 4 products, absolutely clean, no THC. One's an oil, 2 are topicals, and one's an edible. And in fact, we even have one vape pen. It's not on our website. People that want to use it are people that I know that their age, they come in, with the whole vape epidemic. I just want to make sure I know who the person is. We don't want people buying them online and I'm shipping them to a person that shouldn't be having them. So, but we have 4 or 5 products. There's no THC in it. If you did a drug test, it would be clean. So people that are active military, people with CDLs,
what's that?
Commercial driver's license.
Oh.
Or a federal job who's getting drug tested. If you use some of these CBD medications with a small amount of THC, it could show presence on a drug test. My brother-in-law's good friend got fired because that happened to him. He did a drug test. He was using CBD and it became positive on his drug test. And that was an issue. In fact, the Department of Transportation notice from this year, it absolutely states that you cannot use CBD as an excuse for a positive THC test. It is black and white.
Sure. Because
they don't want people having an excuse now. They have THC and, they're driving an 18-wheeler, they have their CDL, and who's liable for that? It is black and white. And actually, that's on our website too.
Do you think, let's say 10 years from now, do you think CBD could disrupt, the painkiller market? I feel like it
has a possibility. I tell you, it has a possibility. It really does. I
feel like that would be so good for people. If the price came down and everything,
it would be great. I think medical marijuana is much better than narcotics, and I think CBD and THC done correctly can totally get rid of the narcotic problem in this country.
So what's the benefit of THC in there? Is that is THC, you do the medical side of things. So there's some THC that is good. There's some levels. Does that help with
some levels, right? If you go to a dispensary and you get pure THC, a pure THC product, it's for recreational.
Sure.
But when there's CBD within that medication, it's called a hybrid. The CBD actually, because it works at the receptor differently than THC, gives you less of the psychoactive effect. I really know, and they don't do this, when somebody overdoses on an edible for THC, what happens? They just get paranoid and they call 911, right? They don't know what to do with themselves. They go to the emergency room, right? And they just give them time. They just have to let it pass. If they took CBD, that would actually stop that effect quicker.
Interesting. The panic.
Because when you have the hybrid of the two, if you're doing a THC, medical marijuana medication with CBD in it, you don't get as much high, but you get more of the medicinal effect. THC is really helpful for people that have appetite loss, specifically people like with cancer, people that are nauseous from, say, chemotherapy. It is absolutely helpful for people with muscle spasms, with multiple sclerosis. These are things that THC is absolutely good for. People that have medical marijuana license, I tell them, use CBD during the day, your mind's clear, and then at night, it definitely does work better for sleep. I'm going to say that with THC. It definitely helps your sleep better. So a lot of patients with medical marijuana license at work, they use their CBD during the day, and then they use their THC at night when they need it for their pain, help with their sleep, for their other medical illnesses. So I think they're definitely safer than, say, narcotics. The reason is also, like, CBD is not, I'm going to tell you right now, people always ask me, am I going to get dependent on CBD?
I was just thinking that tolerances and so forth. Yeah.
You absolutely don't get dependent on it. And that's another study we have on the website, just put on a couple of months ago. They actually compared CBD with 2 anxiety medications that have physical dependence, like Ativan, lorazepam. And they tested patients that they considered drug liking. They had taken these medications before and over a long period of time. I think they had taken it at least 12 months. And they compared the medications and, kind of over time to see if they felt more dependent on one than the other. And there was no dependence with CBD.
Oh, that's so good.
It was unbelievable. It's a great study.
Yeah.
Other thing about THC, forget CBD, THC, physical dependence. We get physical dependence from narcotics. We get it from alcohol. We get it from nicotine. We get it from caffeine. THC, there's no physical dependence. I truly believe when somebody goes to rehab that's a star, an entertainment person, and they go into rehab for marijuana, I truly believe it's something else. Because you don't withdraw from marijuana. You might get some emotional dependence to it, but not a physical dependence where you have these withdrawal symptoms like narcotics, like nicotine. Like, alcohol. That doesn't happen. You don't really withdraw to the point where you change everything about yourself physically. Yeah. So I love CBD. I think THC has a role. And in time, it'd be nice to see this replace some of our pain medications. Yeah. The problem right now is THC, marijuana, is still considered a Schedule I drug, which means there's no medicinal, reason for it.
Oh, interesting. There's not as much research and it's kind of.
Right. That group is cocaine, LSD, heroin, marijuana. They're all Schedule I drugs. So CBD is affiliated with marijuana. So that's why there's not a lot of studies out there just yet.
Interesting. Yeah, because I fully agree with your perspective that basically, to sum it up, CBD, there's literally no downsides. It costs maybe it's a little bit prices, but not dependent. It's not taking your cognition away. It's not ruining your liver. I mean, talk about I hate to say miracle. Miracle seems like, a burst of beaming light that dramatically changes your life. I don't want to say that. I don't want to say that about CBD. I've had it before, and it's
not a miracle. It's just another avenue to help patients. I actually had another company contacted me and said, you got to look at this video. You know, we want you to sell our product. So I look at the video, and this woman couldn't deal with anything, her kids, her husband, and then started taking CBD, and all of a sudden now everything's perfect. And I'm looking at this going, this is BS. This is not like this. Don't make it look like this.
CBD will not make you a better parent. Well,
exactly. This is crazy. It does help, but it's not like a miracle drug. If you look up CBD miracle drug, you're going to see so many blogs about it. It's another way to help. I don't think it's a miracle drug.
Yeah.
But sometimes I look at stuff and go, oh my God, look, I'm a doctor pushing CBD. And I go, this looks like BS. Are you kidding me? You're like, come on, give me a break.
I mean, there's so much of that these days. It's new, you know, there's no regulation. Like, it's like.
Yeah, there's no regulation at all. None. That's what I'm trying to help. I'm trying to standardize it, help people understand where to start, and then go from there, and then follow up with them. Not just say, hey, buy this, use a dropper, and good luck. We want to follow up, act like it's a medical practice, and follow up with patients and give them the right answers. And it helps most patients. It's just that the roadblock of the cost it's tough. But I think I have to say, since we started doing this about a year and a half ago, the prices have come down a little bit. And I think it's all the competition.
Sure.
Our medications have gone down in price because we've gotten to buy them cheaper because these companies want us to keep buying them. So it's a slow process.
Yeah. Interesting. Yeah. I like, I've always been more open to sort of, I'll say, alternative substances that I believe are kind of less mainstream, that kind of get poo-pooed. Another one, psychedelic mushrooms. I feel like they are also sort of in the same category where there's a lot of cultural baggage. People don't understand them.
Oh, yes. I'm going to be honest. I don't understand them either.
Yeah. And I mean, it's just like, they've really benefited me. Yeah. They've benefited many other people as well, but there's so much. Like, I really feel that with both CBD and psychedelic mushrooms, that done safely, done the right way, it's people are missing out. It's like it's right there. It's like imagine if you were starving in dehydrated, thirsty in a desert. You're like wandering for water, and then like just around the say there's a bunch of sand dunes, and like you're looking over, like just over that sand dune, there's water, like just right there, like. You're so close to it. It's right there, but people can't see it. So I've always had a soft spot for really, this is it pretty much. There's CBD, there's psychedelics done safely. I'm kind of starting to get into nootropics, but I'm taking my time there. I actually just ordered some recently, but I haven't tested it. I'm kind of testing it out myself and everything, but I normally don't recommend chemicals. I just, I'm like the yoga guy, right? I'm like, figure it out with your diet, figure it out with your sleep, figure it out with your, Dr. Fauci said, the top 3 keys to not getting COVID: get good sleep, watch your diet, and reduce stress. And like, I'm a firm believer in that.
I read an article a couple of years ago. That's exactly right. It's how to live longer. You said it right there. Eat well, stay active, and reduce your stress, whatever it is. And it's hard to reduce your stress, work, family, all the other things that come with living, but those are the things that you need to do. There's no magic pill. That's why I won't say that this is a magic pill.
Yeah.
This just helps with your stress, helps you feel better, and hopefully it helps you be more active.
Absolutely. Yeah. I feel it.
So it definitely, I think this is we definitely are doing the same thing, different sides of the spectrum, but it definitely works together.
Yeah, absolutely. So like, what's next for you? Like, are you working on the regulation side of things, or what sort of, like, because are you involved in any other organizations that are kind of working on things from a policy standpoint?
I do a whole bunch of different things. I'm in hospice. I'm in a wound center, Newport Hospital, help people with pain management, with steroid injections. Again, talked about medical marijuana with the Department of Health. But with the CBD part of it, what I really want to do is be an educator One of the things I just became part of is with a company called Hemp Meds, which I do like them a lot. They're one of only 2 companies recognized by the physician desk reference, which is kind of the book with all the prescription medications. They have one medication as a supplement that is recognized as they did the right steps to get accepted in this reference. So what they want to do is be that education center for doctors, patients, for consumers. So I'm on the Hemp Meds Advisory Board, the medical board, which is nice. So I think this is what I really want to do. I want to be that part of that big group that not only does the education, but might be the center to get certified medical credits, CMEs, the place where you get to talk to not only patients, but doctors understanding why this works.
Yeah.
And we have about 12 people on the board, and it's, like I said, I think you would be perfect for this, by the way. Perfect, because it's not just doctors. Exactly. We're going to definitely figure this out, but they have, physiatrists there, physical therapists, people that are in chiropractors. It's not just doctors. It's a handful of doctors, but people that want to do it the natural way. That's the goal here, is to be that person, that practice that people call us to ask us, am I doing it right? How do I do it? Is this the right medication? It's been a slow process, but it's getting there. Slowly but surely, we'll get there.
Yeah, and where you mentioned it in the very beginning, back to basics, llc.com. That's kind of where people can find out. And it's spelled, so how do you spell that?
It's BAK 2 basics llc.com. And then like you do
we gotta get you a simpler name, man.
I know, it's too much. And then the easier go, if you search if you search the podcast, just write CBD Health Dr. Rocco or CBD Health Podcast, and they do the same thing here, just talking and helping people understand a little bit about what they need to understand.
Yeah.
So I'm trying to do. It's like you're doing, we're just trying to disseminate the right information so people know what to do.
That federal label of marijuana being a Schedule 1, I feel like it. Well, I'm thankful that I think they're voting, right? Or the House is whatever.
It's not even close. Yeah. I was last June. I was at a pain conference learning about narcotics and doing it correctly. And the woman there was unbelievably awesome. Older lady, physician. She did it the right way. Like if you were going to get narcotics, she did it correctly. She would see patients every month. She would assess them properly, check their function. But at the end of the conference, she talked about CBD and THC. And she mentioned that it's a great avenue, but there's problems. And I absolutely raised my hand. I go, I know what it is. It's because it's a Schedule 1 drug and it's affiliated with marijuana. I goes, you're absolutely right. And then I went on a rant for 15 minutes. She had to shut me up because this woman liked to be in charge. But she's afterwards, she goes, you hit every right point. And that's the first problem. We got to get marijuana as a Schedule 2 or 3 drug. And then things will flow from there, meaning that there's not going to be any educational or National Health Institute grant about a Schedule 1 drug.
Yeah.
I can tell you they did do a grant for $3 million. That's what it was. It was $3 million grant for 10 places to look at CBD use for chronic pain. And there's different locations in the country. $3 million sounds like a lot. That's nothing. Usually when you do a grant, it's like $100 million, when they're looking for real research. But at least they're starting somewhere to look at CBD. Is it going to help with pain? So I was excited about that. That grant just started in 2019. So hopefully by the end of maybe next year, we'll get some information from that. So they're at least thinking about that. But the Schedule 1 is just making it so difficult for medical marijuana being acceptable through every state in the country. And then it's also the problem with CBD. With me talking about CBD, a lot of people think I'm going to just automatically go into marijuana. They don't want to hear about that.
Yeah.
That's not what we're doing here. If you look at our website, it's all about CBD. It's not about marijuana. I can easily talk about it, but that's not the goal. The goal is, hey, let's try something. You don't need a medical marijuana card. It's legal. Just do it properly. Know some of the pitfalls. And the main pitfall is if you're somebody that gets drug tests, you could be positive if you use the wrong one.
Mm.
But I will tell you, the one that does have a little bit of the THC, it's called a full spectrum medication. They actually do work better because the CBD and the THC have a synergistic effect. They call this an entourage effect. You actually do get a better effect at the same dose if you took it just the isolate with just CBD in it. So people that use isolate, I tell them you might need a little higher, dose. That's fine, but you have to know that. That's all you need to know.
Yeah. Yeah. I feel it.
I'll send you some.
Yeah. Thank you. That'd be awesome.
Yeah.
I wonder, yeah, we'll figure out. I feel like we're kind of reaching a stopping point. I wonder, I hear everything. I feel like, yeah, this is a pretty good, am I missing anything? What, anything? Yeah.
I could go on for another hour if you want.
Yeah.
There's so much to talk to. That's why the podcast is easy for me to do. All right, I think of a subject, I write some notes out, and I can talk for a good, 15, 20 minutes on just one thing like sleep. And then, you're going like different ways of using the dosing. And it's, there's so much to talk about. We just hit the tip of the iceberg.
We might have to have you back another time. We'll figure it out. Yep. Okay, let's wrap things up for the day. Thank you so much for coming on.
Absolutely. Love it. Thank you for having us.